1 in 9. Take just a second to let that number really sink in. Right now, 1 in 9 Japanese women will develop breast cancer in their lifetime. This isn't just some abstract statistic buried in a medical journal. It's a reality that means pretty much all of us know someone, a former classmate, a best friend, a family member who has faced this disease. It's an absolute shock to the system, and it demands our immediate attention.
Welcome to The Explainer. Today, we're kind of treating this whole thing like a medical detective story. We're going to uncover exactly why breast cancer rates are skyrocketing in a country where it actually used to be remarkably rare. We'll look at the hidden biological culprits, the lifestyle accomplices, and, most importantly, the evidence-based actions you can take right now to protect yourself. Okay, let's dive into this and look at the evidence together.
So here's our roadmap for today. We'll start with the breast cancer surge itself, then explore the estrogen connection, hidden risks like obesity, and the Western diet trap. Then we'll wrap up with the good stuff, protective foods and movement as medicine. Let's get right to it. Section 1. The breast cancer surge. Let's start by looking at the facts on the ground and see how drastically the medical landscape has changed here. Historically, Japan was known as a country with super low rates of breast cancer, but today, the numbers have just completely skyrocketed. And like we said, this isn't just happening to anonymous numbers on a chart. It's a highly visible issue touching everyone's lives. We've seen high-profile figures in the entertainment industry, women like Anna Umemiya, Kuniko Yamada, and Akira Hokuto, all battle the disease, and tragically, Mao Kobayashi lost her life to it. So the big question we have to ask is, why now? Why has a once rare disease become so incredibly common? Well, to answer that, we really need to meet the primary biological culprit. Section 2. The estrogen connection. Okay, the absolute crucial point here is understanding what estrogen actually does. It's a female hormone, right? Produced in the ovaries, it gives a woman her female characteristics. But here is where things get a bit dangerous in the context of cancer. Breast cancer is what we call a hormone-dependent cancer, and one of estrogen's main jobs is to cause the cells in the mammary glands to divide and multiply. Think of it literally like fuel. The longer your body is exposed to high concentrations of this fuel, the higher your risk of developing breast cancer. And the amount of estrogen in the body is directly tied to a woman's menstrual cycle. It's simple math. The more periods you have, the longer your body is exposed to that fuel. Today, girls are getting their first periods earlier, and women are experiencing menopause much later. Combine that with modern trends like later marriages and having fewer pregnancies, which, remember, temporarily hit pause on menstruation, and modern women are suddenly facing a drastically extended lifetime exposure to estrogen. But here's the thing, estrogen from the ovaries is really only half the story. Let's transition to Section 3, our first major lifestyle accomplice, obesity. Get ready for the post-menopause twist. Because you might logically be thinking, hey, once I hit menopause and my ovaries stop producing estrogen, my risk drops, right? Actually, no. You have a secondary estrogen factory hiding in plain sight, your body fat. Subcutaneous fat continues to pump out estrogen even after menopause, and that makes postmenopausal obesity an absolute major trigger for hormone-dependent cancers. Let's do a quick mental calculation of your BMI right now. Take your weight in kilograms and divide it by your height in meters squared. Hitting a BMI of 30, that puts you straight into the danger zone. For example, if you're 155 centimeters tall, 70 kilos puts you in the red zone. If you're 165 centimeters, 80 kilos is that threshold. And honestly, escaping that danger zone is a total game changer. It doesn't just lower your breast cancer risk, it drastically cuts your chances of stroke, heart disease, and diabetes too. All right, let's look at what's on our plates. Section 4, the Western diet trap. This is our second major accomplice. There was this massive study involving roughly 50,000 Japanese individuals that tracked exactly how diet impacts breast cancer risk. They compared two entirely different eating patterns. On one side, you have the Western diet. Highly processed, super meat-heavy, lots of sausages, bacon, heavy mayo, and alcohol. And on the flip side, the traditional Japanese diet. Lots of vegetables, fish, green tea, rice, and miso soup. And the results? They were absolutely staggering. Eating that Western-style diet increased breast cancer risk by a massive 32%. 32! And if you want even more geographic proof, researchers looked at Japanese women living in Hawaii and the U.S. mainland. They found their breast cancer risks were significantly higher than Japanese women living back in Japan. It brilliantly illustrates that our transition away from traditional meals over to these extreme, high-calorie, fat-heavy Western diets is acting as a direct accomplice to the surge. But okay, enough about the accomplices. Let's pivot from the risks to the solutions. Section 5. Foods that protect you. Let's clear up a major misconception right out of the gate: soy. There used to be this old myth that because soy isoflavones look molecularly similar to estrogen, they might increase cancer risk. The reality? Studies show they actually lower it. Isoflavones step in and literally block estrogen from binding to your cells. They act incredibly similar to a famous breast cancer treatment drug called tamoxifen. But here is the absolutely crucial rule of engagement. Get your soy from whole foods, like tofu and natto. If you decide to use concentrated supplements, the Ministry of Health strictly warns to cap it at a maximum of 30 milligrams a day. Taking massive, unnatural doses, the long-term effects of that are still entirely unknown, so play it safe. Next up on our protective foods list is dairy. Dairy is packed with vitamin D, calcium, and linoleic acid, which have all been shown to lower breast cancer risk. But, and this is a massive but, it must be low fat. The data is super clear that high-fat dairy can completely backfire and actually raise your risk. And please, don't fall into the trap of thinking, if a little is good, a ton must be better. Studies actually reveal that the protective benefits weaken if you drink too much. The sweet spot? Just 1 to 2 cups of low-fat milk a day as part of your normal routine. So we have our diet locked in. Now, let's introduce our final tool. Section 6. Movement as medicine. Movement is quite literally medicine. The Japanese Breast Cancer Society's guidelines confirm that exercise almost certainly lowers breast cancer risk, especially for postmenopausal women. And why is that? Because it acts like a domino effect, wiping out multiple risk factors all at once. It directly combats obesity and diabetes, both of which are massive triggers for cancer. And it doesn't have to be brutal either. Walking, running, swimming, dancing, tennis, really whatever you enjoy. The science shows that consistency absolutely beats intensity here. Do it regularly. Just be careful not to overdo it to the point of injury. So, we've uncovered the estrogen connection, the hidden traps of obesity and the Western diet, and the powerful shields of traditional foods and daily movement. I want to leave you with this one provocative thought. How are you going to change your lifestyle starting today? Breast cancer numbers may be surging, but your personal risk level is actually largely in your own hands. Take agency over your health, audit your daily habits, and please share the knowledge from this explainer with the women you care about. See you next time.